Good afternoon. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Coastal Bend COVID-19 Task Force. It's December 28th, 2020. The task force has two objectives. One is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. There are several COVID-19 interventions in place right now. You're encouraged to stay at home if you can. Face coverings and social distancing are still mandated in public places per a state order. You're encouraged to isolate when exposed or symptomatic. And when we're talking symptomatic, you don't need to have really bad symptoms to need to self-isolate. Even minor symptoms that you'd associate with a minor cold or flu, you want to self-isolate, contact your doctor, and probably get tested and continue to isolate until you get the result of that test. There's also been partial remote schooling, which, at least as far as I know right now, is continuing. And we're in a phase of open Texas where businesses are able to operate at 75% of their capacity and bars are operating at 50% of their capacity. Now, this is a general level. I know for specific businesses there can be particular levels. I encourage you to look for Open Texas on the internet for your particular business to know where you should be at. Right now in the Coastal Bend, we're at 32,083 total confirmed cases with 28,578 recoveries. And presently, there's about 2,664 active confirmed cases in the Coastal Bend, and this is about 100 more than there were last week. You can see in the graph that there's been a slight increase over the past couple weeks in this number of active cases. We'd like to see this start turning downwards, but for now, it's slowly increasing. We have no change in our model projection right now. We estimate that the transmission rate is approximately 1.13. I want to calibrate you to this graph where it is the transmission rate going from 0 to 3, where a 1 indicates that for every person that gets COVID, they transmit it to one more person. That's why we have this as a dashed line. This is the dividing line between increasing above the line, like where we are now, or decreasing below the line, likely we were leading up to and a week after Thanksgiving, what I'm calling the Thanksgiving lull. Now, right now, we're projecting that we'll continue along this same trajectory with a slightly decreasing transmission rate, which is caused by more and more people being recovered from COVID and presumably not able to contract it again until we hit this line here, which is which is when businesses are projected to go from 50 or 75% operating capacity to 50% capacity. We'll also show you the calibration very quickly here because there's a couple points that I want to make. What you see here is in black, we have the total number of new cases per week. So each one of these points is given per day, and they represent the total number of cases for the previous 7 days. And so this is how we're calibrating the model. You can see the black points here are the actual number of new cases, and then the orange points are what we're calibrating to, with plus or minus 20% on either side of that in the transmission rate, which is represented by the green and the blue lines. One thing that you'll see back here is that the black line is going above the orange line, and what's happening there is that this is where the backlogs are being filled in from the state. Those cases that earlier on were showing up as icing in the graphs that the city of Corpus would show. In my graph here, you can see that what the result is this black line starts going above the orange line. Now, before the backlogs filled in there, they were at approximately the same level, overlapping with each other. So you can see that kind of for the past several weeks, there hasn't been an effect of those backlogs. And now most recently, right here in the last 2 days, the holiday weekend, we've seen a precipitous drop in these numbers. I haven't changed the calibration yet because if these numbers come right back up, say today through Friday, then there's probably no reason to change the calibration of the model. And so we're keeping it at that orange calibration point. So that orange calibration point is represented here in the daily number of new cases. So the black points, those are the observed number of new cases per day, and the orange line is the projected mean number of new cases per day. So right now what we're projecting is that on January 11th, we're going to hit that threshold where business capacity will transition from 75 to 50%. This, of course, can change depending upon what happens with the transmission rate. But if the transmission rate stays at that 1.13, then this is what we expect to see occur. Moving on and breaking down those new cases by the 12 counties in the Coastal Bend, you can see Nueces accounts for the majority of the cases of all the counties, and it's trending upwards. For the other 11 counties, I find it easier to zoom in, and I know this isn't the most aesthetically pleasing graph, but it does have one line for each of the other 11 counties in the Coastal Bend, and you can see some of them are going down due to that kind of weekend effect of a low number of cases being reported, but Duval and Jim Wells are headed upwards despite that holiday weekend having just occurred. Moving on to the South Texas area and the metro areas in South Texas, we can see again there's this effect of the holiday weekend where there's a downwards turn in a number of the metro areas in the South Texas region. And before those two data points came in, these lines weren't turning downwards so much. So I expect that, unfortunately, these are probably going to turn upwards, most of them, again, as new cases come in over this coming week, and we'll have to keep tracking that. Zooming out to the whole state of Texas, and we like to show this view as one way of comparing where we are at in South Texas to the rest of the portions of Texas. But also, if you need to travel to another part of Texas, this gives you an idea of what's going on there with COVID. So here, what we're showing is the number of COVID cases per 100,000. And you can see that Amarillo and El Paso/Lubbock and this north and west Texas area already had a peak in the fall and are coming down. But the rest of Texas, they didn't really hit that peak level yet. And most of them are still increasing despite the weekend causing this downwards pattern. Moving on to hospitalizations, the black points again represent the number of people counted in the hospital on a day. We call this the daily census. And the number of new cases the daily census has risen to match the model projection. Since maybe a week before Thanksgiving, the number of inpatients dropped below the projection, but now it's kind of come back up to where the projection is, and it gives us a little bit of confidence in that projection. There was an abrupt increase on December 24th, so you can see that occurring right here with this data point. That's December 24th, 25th, 26th, 27th. So there was a decline from the 25th, 26th to the 27th, and we'll see what happens. The projection is for these numbers to continue to increase. Now, one thing that we're concerned about with those numbers is hitting this threshold where businesses would roll back their capacity. If we go above 15% of the staffed hospital beds having COVID patients for 7 days in a row, that's what triggers that rolling back of businesses from 75% to 50%. Over the weekend, or actually on Christmas Day, we got up to 13%, and today, or yesterday actually, we were down to 12%. I don't have today's data yet. Overall, if you look at this, it looks like we're increasing towards that 15% level, and from the projections, you can see that we're thinking right now, or at least not we're thinking, but the projection indicates that given the same transmission rate, that by January 11th, we will have been above 15% for 7 days. Moving on to the ICUs, and this is something that we're really concerned with, the ICUs, because that's the part of our hospitals that were the most hard hit in the summer outbreak of COVID. You can see here, this blue dashed line represents the approximate number of ICU patients that we would see in coastal bend units. And during the summer outbreak, the number of COVID patients exceeded the normal number of non-COVID patients. Right now, what we're seeing is there's been a decline over the past week, very similar to the decline that we saw leading up to Thanksgiving, which you can see there. And so we did see a similar pattern in the number of people in the ICU to what we saw at Thanksgiving, but we didn't see as similar a pattern, at least not yet, with the number of new cases or the total number of hospitalizations. Moving on to this next graph, which is a bunch of these graphs, essentially. So this is one panel. It occurs right here. Right here for Corpus Christi or the Coastal Bend area. And then there's one of these for each trauma service area in Texas. And this is here to give you an idea, if you're traveling around Texas, how stressed out are the ICUs, how much load is there. You should compare the amount of red to amount of blue currently. Another way to do this is by looking at yesterday's data. Again, blue, non-COVID, red, COVID. This is for ICU capacity, or the number of people in the ICU. And the more red you see, the greater proportion of people in the ICU are COVID positive. And what you'll notice is a pattern of, as you go north and as you go west, there becomes more red. And as you go south and east, for the most part, there's more blue, except for Victoria and Laredo, where there's quite a bit of red there also. Okay, moving on to the fatalities. This is a graph that I don't show very often, just because it's usually redundant, but here it shows you a pattern. And we see this precipitous drop in the weekly count of fatalities due to COVID. And what we think is happening here is the state might have gotten a little bit behind with the holidays and counting the death certificates. Remember that to get this data, there's a team at the state that's looking at the death certificates and determining whether COVID was the primary cause of death or if it was a secondary cause. And if it was a primary cause, then it gets logged as a confirmed fatality from COVID. Now, if the state gets a little bit behind, you might see a precipitous drop like this. And the reason why we think that's what's happening is because based upon everything, all the other information we have, this number should be increasing. Unfortunately, now we hope that this is real and all the death certificates have been collected or have been counted, and this is a real pattern that's due to the amount of fatalities, but we suspect strongly that this is due to not all the death certificates getting counted from this period of time yet. The other thing that I want to have you look at, which is pretty interesting that you can see in this graph, is that notice that our fit of the model projection to the actual data in the summer is low, but it's really good, at least up until this past week, in the present. And the reason that is because we had to recalibrate the model because there seems to be a lower probability of somebody dying from COVID presently than back during the summer outbreak. And so because of that, we wanted to calibrate the model to the present time rather than back during this peak, where presumably we've improved in the way that COVID is being treated in the hospitals, and that's leading to fewer fatalities. Hopefully, maybe this is also occurring because people are seeking medical help earlier and getting tested earlier than maybe they were back in the summertime. This is the graph that we usually show for fatalities. It's kind of hard to intuit here, but there's a lot of there's a lot of numbers down here that are lower than we expect. That's these points here and the sum of the weekly number of fatalities. These are the daily number of fatalities. So they've dropped, but we think that's artificial due to a backlog in counting the death certificates, and we do expect this, unfortunately, to continue to rise. Looking at the total number of fatalities in the Coastal Bend, we're at 841 due to COVID-19, with 537 of those 841 happening in Nueces County. So the rest of those fatalities occurring in other parts of the Coastal Bend. And notice again, here's this effect. See this leveling off? That's due to death certificates not being counted. This data that we have down here is the data that we received directly from the city of Corpus Christi and the county of Nueces, and so we don't have to wait for the state to count those death certificates. So it's actually, when we compare, say, this data point to that data point in the future, there'll be a growing disparity between them, and maybe this number is closer to 900 than 850 once those backlog death certificates get filled in. So unfortunately, we expect this to keep increasing. And this inset here, see, oh, right there at the upper right, or sorry, the upper left, it shows you the number of new fatalities per day, and the purple is Nueces, so you can look at the number of new fatalities compared to where we were in the summer. It's quite a bit lower. Now it looks like it's peaking and starting to go down, but again, we think that's an artifact of the cases not being counted. This line is coming from the state's data, not from the city's data like this is. And the other thing to notice is San Patricio here is coming up appreciably to where we can see it on this graph now. And we'll be watching this closely in the future and seeing hopefully if we can force this to bend downwards before we hit those peaks that we saw in the summertime. To round out the presentation this week, I want to talk about the holiday celebration scenarios again. So we run a predictive model that allows us to ask questions of what would happen in the future if this were the case or if that were the case. So here we're going to compare two scenarios. One is what would happen if we just went back to normal and celebrated the holidays normally, celebrated New Year's Eve the way we normally would, the way we did in 2019, and have multifamily celebrations, public celebrations, no masks, no social distancing. You get the idea. That's one scenario. Definitely don't want you to do this, and you're going to see why on the next slide. And then there's scenario two, which is kind of a moderate good case scenario where we're saying, well, what happens if we see the same behavior that we saw on Thanksgiving in 2020 and the week before and the week after Thanksgiving, which led to a decrease in the spread of COVID, at least for about a 2.5 week period. So this model is based on the observed transmission rate in the coastal bend around Thanksgiving versus this one, the transmission rate, we allow it to go up to the level that it achieved during the summer outbreak. And this is what the results of that look like in terms of the projected number of new cases per day. And what you can see is that it doesn't take a very long time, a week, for us to go from where we are now to a peak that's higher than the one that we saw in the summer if we let our guard down right now. And so this is one of the reasons why we're really strongly encouraging everybody to continue to maintain your vigilance, continue to wear your masks, continue to social distance, try to avoid celebrating with the general public, with multifamily scenarios that are inside, because what can happen is really something that we don't want to see happen here in the coastal bend. Looking at the green scenario, which here celebrate like Thanksgiving 2020, it's not the most desirable outcome in the world, but it's better than the red scenario. Now, the reason why I say it's not the most desirable scenario is that we stay at the same level of new cases per day. This is not cumulative. This is not the total number of cases. This is the new cases per day. So we're staying, somewhere near this 200 new cases per day level for the whole coastal bend, which is really it's really high, and we really don't want to be as high as this, but it's better than what would happen if we were to go back to normal. So moving on to what this would look like for numbers of inpatients, again, doubling or nearly doubling the number of inpatients that we expect to see in the hospitals if we had normal celebrations and everybody just kind of went back to normal and stopped trying to mitigate the transmission of COVID-19, versus if we treat the holidays conservatively like we did for Thanksgiving, we could expect a modest increase in the number of inpatients and not a scenario where the hospitals would be overwhelmed. And again, for fatalities, it's the same sort of thing here. If we go back to normal, right now, we end up with really an unacceptable amount of fatality in the Coastal Bend area, and it could even be exacerbated by overwhelming the hospitals. So this is assuming this is assuming the same level of care at the hospitals as you'd get now, and that might not be the best assumption in this scenario. So if we celebrate like Thanksgiving, again, it's not great because the number of new fatalities per day stays at a pretty high level. At least it doesn't, go sky high here. So in summary, the transmission rate's above 1, and the fall-winter outbreak is continuing. The proportion of COVID patients of all staffed hospital beds right now is 12%. If we go above 15% for 7 days in a row, then that triggers a decrease in business capacity. This is something that we don't want to happen. We don't want there to be so many people sick with COVID. We don't want there to be so many people sick with COVID that we have to decrease the amount of business activity that's happening in the Coastal Bend. The last thing here is that the fatalities per day are expected to increase despite the graphs you saw that indicated that they were precipitously dropping. We believe that that's due to a backlog in counting the death certificates as opposed to a real phenomenon. And rounding out 2020, again, I want to remind everybody it's not a normal year. And as we go into 2021, at least the beginning of 2021 is not a normal year either. We're encouraging you to avoid public celebrations for New Year's, avoid multi-family New Year's celebrations. Pretty much, if you wanted a year where you're going to, celebrate New Year's Eve quietly at home, this is the year. And then face coverings, definitely keep wearing your face coverings, definitely keep social distancing, keep it up. We're not close to herd immunity yet in the Coastal Bend, and as those projections from the scenarios in the last few slides showed you, within a week's time, we can go from where we're at now to really an absolute catastrophe. And so it's really important to keep trying to mitigate the spread of COVID and do our parts. So I'd like to thank everybody for listening to this week's report. We'll update as necessary on our social media pages. We've got Facebook, Twitter, and Instagram. Our handle is at CBCovid. If you search CBCovid, you should find us there. As developments arise, we'll post new figures there and updates. I also want to remind you that we're doing our weekly Q&A session on Thursday at noon. This will be with Nueces County Public Health Director Annette Rodriguez. And the way it works is you post questions on our social media pages or send them in an email to us, and they're collated, and then we try to address them live on air on Fridays at noon. We also try to write back answers to all the questions that we get on the social media pages. And if you have a question that arises while we're on air on Thursday at noon, then you can type that into one of our social media pages. We have people monitoring them, and we can answer that question directly for you live on air. So I'd like to thank you very much, and I hope everybody has a great week.